Is sensory processing disorder an invisible disability? Imagine walking through a busy mall where every sound feels like a loud alarm, bright lights hurt your eyes, and even the gentle touch of a shirt feels overwhelming. Now, picture trying to explain this to someone who sees you as perfectly fine. That's what living with sensory processing disorder can be like. Sensory processing disorder is a neurological condition where the brain struggles to receive and respond to sensory information properly. It affects how people process sights, sounds, touch, taste, and movement. Some may be overly sensitive to stimuli, reacting strongly to normal sensations. Others might not notice sensory input at all, leading to difficulties staying focused or calm. Some individuals seek out intense sensory experiences because they crave stimulation. Because these symptoms are not visible just by looking at someone, sensory processing disorder is considered an invisible disability. People with SPD often look typical, but they face real challenges. For example, they might have trouble with motor skills, emotional regulation, or staying organized. These difficulties can make social interactions, school, or work harder, even though outwardly they seem fine. Understanding this helps us see why recognizing invisible disabilities like SPD is so important. Healthcare providers need to be aware that not all disabilities show on the outside. They should ask about sensory issues when patients report problems with focus, anxiety, or behavior. Schools and workplaces should also provide accommodations, like quiet spaces or sensory-friendly environments, to support those with SPD. Advocacy for better access to diagnosis and treatment is key. Many people with sensory processing difficulties benefit from occupational therapy, which helps improve how they handle sensory input. Creating inclusive spaces that recognize invisible disabilities helps reduce barriers and promotes well-being. In practice, this means healthcare professionals should screen for sensory challenges even if there are no visible signs. Teachers and employers should be trained to understand sensory needs and provide appropriate support. This approach ensures that people with SPD receive the help they need without feeling misunderstood or dismissed. To sum up, sensory processing disorder is an invisible disability because its effects are not obvious to others, but they can significantly impact daily life. Recognizing SPD within the framework of invisible disabilities encourages more inclusive health care and support services. It reminds us that sometimes, what we cannot see is just as important as what we can.